Now, a bra made almost entirely of used Rooibos tea bags has been created by a leading lingerie brand to raise awareness about breast cancer, which affects 1 in 27 South African women. October is National Breast Cancer Awareness Month. And now this unique bra will be auctioned at a fundraiser, the proceeds of which will go to CANSA's women's education programs. In our Johannesburg studio is Lucy Balona from the CANSA Association. She's here in the studio with me. And in our Cape Town studios is Isla Lovell, who's owner of Storm Energy Cup. She has a bra right in front of her there, as you can see. Absolutely amazing. Isla, this is a masterpiece.
Thank you. It's taken some hard work, and we're very impressed with it, and we're hoping it's going to fetch what it's worth.
And we'll talk about how much it's going to fetch in just a moment. But I believe that you got tea bags from South Africans around the country. How many tea bags did it take to make this beautiful bra?
Well, I must just firstly say we are so impressed in how wonderfully the public got involved and how many tea bags were donated to us. It was fantastic. It's taken us around about 450 tea bags to actually complete the bra. We've made several prototypes in the last couple of months as well, but this final product has used about 450 tea bags.
And how many hours?
Oh gosh, I stopped counting, if I have to be honest with you, because it's a very, the tea bags are very fragile. We actually landed up, using different ideas on how to do it. And because they are so fragile, it was very painstaking, a lot of hand stitching, a lot of sort of also under the machines, but it's a very fragile, delicate product to be working with, but absolutely a fantastic, awesome product to use because of its natural pigmentation.
So is there any colouring, or is it all natural, just looking at that rose petal colour that you've got for the bra?
No, so what we did is we actually, obviously, depending on how long the donated tea bags had actually been stained, how long they'd been in the water to sort of the colours, we did add pigmentation to it as well, and that's where you can see the red is coming from. But you'll also see, if you can see intently, there's areas where the natural brown came through as well, and then the red actually held to the tea bags were actually the darkest.
All right, so let me engage Lucy now on this. Lucy, whose novel idea was this?
Was actually a Storm Energy Cup, and a big thank you to the Rooibos Council. So obviously Rooibos is a healthy option, and it's got fighting properties that help with lowering the risk of cancer. So for us it was a natural fit, and for us it was such a novel idea of this is a way that we can get our message out there to women to say, you know what, you need to know about breast cancer because it's the leading cancer in South Africa. So for us it was the opportunity to talk to women and say, you need to go for screening. And if you are a breast cancer survivor, you don't have to face that journey alone. We're here to help you. So for us it was quite exciting. It was so unusual, and we got so excited when we started seeing the tea bags coming in. And it's a beautiful
And you
product.
could have never imagined that it would come out like that, would you?
No, it looks absolutely beautiful.
So Anna, did you always have an intention to work with the CANSA Association, and what made you have this idea of having a bra made out of Rooibos tea bags?
Well, we've worked quite closely over the years with the CANSA Association, getting as much involved with things that we can help them with. And basically with the Rooibos, it was the Rooibos Council and CANSA, we all kind of came together and thought, what a fantastic idea. Everybody, generally every woman, wears a bra. And it's something that we all can relate to. Not all of us have necessarily been touched by breast cancer, but somewhere along the line our family has. And so this was just such a fantastic collaboration to be able to put us all together and use a product that we all drink, the Rooibos tea with its fantastic properties, to work strongly with cancer, now towards Breast Cancer Awareness Month, and putting it into a bra because every woman relates with a bra.
So I'm just wondering then, Lucy, I mean, obviously Isla spoke about it earlier on, the healing properties of Rooibos, and it's such a pity we couldn't have the Rooibos Council here with us, but you would have spoken about this, the symbolism. So tell us about the healing properties and why even just wearing something like that could help.
Well, it's got cancer-fighting properties. So what it does is that inflammation is a leading cause of cancer. So with the properties in the Rooibos tea, it helps to fight that off. But I think also the bra is a symbol for women to know, like she says, every one of us wear a bra. Breasts are part of us, and we need to know we actually need to know about our breast. We need to know what are the signs, what are the symptoms, and what's different. So I think what we're saying is to women, you should know how your body feels. And we want to encourage, you know, the Cancer Association of South Africa wants to really encourage women, you need to do regular breast self-examinations. And you can also...
What is regular? Let's just start
Regular
with that.
would be once a month after your period. And if ladies go to our website, you can find all the information there, but also... important, you can go to a cancer care centre and you can get a clinical breast exam. And then women over 40 should be going for a mammogram, and you can get it at your local health provider. And actually this month the Radiological Society is actually offering discounts to women to come and get a mammogram. And I think particularly women, if you've got a family member in your family who has been affected by cancer, you're at a higher risk. So those are women that definitely need to be aware.
So you're talking about discounts and how they're available, but obviously there are women who can't afford this. And I do know that there are institutions that offer this for free. Tell us about that.
Well, if you go, there are a lot of public hospitals that should be offering for free as well. And then what we do at our cancer care centres, we do the clinical breast exams. And we also raise awareness, you know, all the information, all the funds that are raised from the auction and from our programs to raise funds will actually be for our women's health program. And we don't just raise funds, awareness about breast. One of the things we do is also raise awareness about cervical cancer, because that's the second leading cancer that's affecting so many women. So what we do is also offer pap smears, so that women, when they come to our cancer care centres, they can get a clinical breast exam and they can get a pap smear as well.
Isla, we spoke about the money earlier on, how much the bra is likely to fetch. There's been lots of speculation. What are you hoping for?
Look, we're hoping for, we don't know at this point. We're hoping that people just get behind their initiative and just really give us as much as they can. And you know, it is going to such a fantastic cause that we're just hoping people dig deep and support it. We're hoping it'll fetch as much as it can. Madonna's bra went for, I think it was $50,000 US, so maybe we could hit that.
Okay. In South Africa, $50,000 US. I know that's a very bold figure, but you say, as you say, it's a very good cause. So let's talk about how the money will be dispersed and how this helps fight or keep the momentum going with breast cancer. Lucy, just tell us a little bit more about where's the money going to go for.
So what we do is, for us, we're so grateful to partners like this, because that goes towards our women's health initiatives. What we do is we go out and we do lots of education. We have to go out to communities that don't have access, that don't know about cancer or don't know about basic health health systems or health screening. So what we do is we've got mobile health clinics that go out to the communities, or we do education. We've got employee wellness programs. So we're constantly trying to spread our health message. We're sharing information on all our social media platforms. We also have a toll-free line where people can phone in if they haven't got access to data or they need to get information. So that's what we do. And also to help patients if they have been diagnosed. We need people to come to us, tell us you've been diagnosed so that we can help you. You don't have to face that journey alone. We've got 12 cancer care homes where people are getting treatment. So if they're getting radiation treatment, we transport them to and from the hospitals. We provide meals, transport, and that's how we support those that have been diagnosed.
And I know some organizations even collect bras for people who've had mastectomies, and obviously they are unable to afford them as well. So there are lots of great initiatives out there. Let me ask as a final question to both of you, and I'll start with you, Isla, in Cape Town. Have you had any personal experience with breast cancer in a family or friend you know, or somebody that has inspired you, to even come up with a concept like this?
Well, to be honest with you, I haven't personally had any in my close family, but this is something that's been very close to my heart. I actually trained in London with the Corsetiers to the Queen, and one of the things I trained in was prosthetics and mastectomy garments. So actually, when I came back here, we started storming a G Cup, and since then we've become so passionate about helping ladies and making them feel whole again after surgery that we've actually opened 2 practices specializing just in mastectomy and post-operative garments. And the other thing as well is, I did hear you mention about donations. We'd be happy to take donations, and we do then take them out and give them to the community where it is required on both mastectomy bras as well as prosthetics. So it is something we are passionate about and really are something that we want to take further and help as much as we can with as well.
So how do people find you if they'd like to follow you up on that request?
So we're on social media. You can find us on Instagram at Storm Energy Cup, or on Facebook, also Storm Energy Cup. And then also we have several branches in Cape Town.
All right. And final word from you, Lucy?
Well, just for everybody, thank you for all our partners getting involved. And our message would be to women, make sure that you do your clinical breast exams, or make sure you do once a month your breast self-exam. And then for the ladies that are over 40, make sure you go for a mammogram. And for anybody who wants to get involved, they can find us on social media. We've got a toll-free line, and you can also just send emails, info@cansa.org.za.
And the ribbon does say hope. So obviously it's to basically say that for people who've had breast cancer, there is still life afterwards.
Absolutely. You know, being diagnosed is not necessarily a death sentence at all. So it's about giving hope to others, and also to do awareness in communities that aren't even aware. You know, part of our research is we do some research about the stigmas that some women are facing. Some women are actually ostracized when they get diagnosed, and it shouldn't be that way. So it's the more education, the more that we can encourage women to get educated, and the more that women know about screening, the better it is, because early detection is key, because that means there's a better chance of survival and better chance outcome of the treatment.
Well, thank you very much to you both. Isla, I hope you do get that $50,000 US, and certainly all of those with deep pockets here on the program, listening, watching, will be able to donate to you. Thank you very much. In our Johannesburg studios, Lucy Balona, spokesperson for Cancer Association of South Africa, and in our Cape Town studios is Isla Lovell, who is owner of Storm Energy Cup. And remember, it is Breast Cancer Awareness Month, so do the right thing, do get screened and tested. Let's take a break, don't go away.